Hi, I'm Dr. Saqib Mansoor, and my today's topic is parotid region, parotid region anatomy, with the particular emphasis on the parotid gland. Yes, and first of all, we will determine the, boundaries of the parotid region. So parotid region is a posterolateral part of the facial region. So here you see this is all our face, and this is the posterolateral part of the face. This is the posterolateral part, and here is our parotid region present, the most important structure contained within the parotid region is a parotid gland. Here is a parotid gland. This you see, this is a parotid gland, pyramidal shaped structure, salivary gland, one of the salivary gland. So this is the parotid gland, and here you could see the parotid region. What are the boundaries? Superiorly to the parotid region boundary is this zygomatic arch. This is superior boundary, and posteriorly it is auricle, and then is a sternocleidomastoid. This sternocleidomastoid and this auricle, right? And then we get go there, and you see here this is the mandible, and here somewhere would be the ramus of the mandible. So this medial aspect of the ramus of the mandible. So medially ramus of the mandible. So then anteriorly, what is that? So anteriorly, this is the anterior border of the masseter muscle. This is the masseter muscle, which is one of the muscle of the mastication, the four muscles of the mastication. And we will discuss in a separate topic muscle of the mastication. So this is the anterior border of the masseter. This bounds this parotid region. So what we conclude here, it is a conclusion that masseter is included in the parotid region. This is one of the contents of the parotid region. This is masseter. And this is the thing. And then inferiorly, the boundary is this apex. And this is for this mandible part of the inferior border of the mandible and the angle. Mandible angle and the inferior border. So these are the boundaries of the parotid region. And as we move on, and the contents, what are the contents of the parotid region, right? So I told you most important content is this, our parotid gland, one of the salivary glands. Other salivary glands are the submandibular and the sublingual salivary gland. And then you see this, right? This is our this parotid gland. You see this tracing. This is the parotid gland. So let me enlarge it for a better view. You could see here, right? This is the parotid gland, and here is the masseter muscle enclosed, and it is a part of the parotid region. And here you see very important retromandibular vein, and then the external carotid artery, and the retromandibular vein. And so very important, that is a facial nerve, the plexus of the parotid plexus of the facial nerve, or the our this seventh cranial nerve. This is the contents over here, the most important contents. These are enumerated over here. So this is the largest salivary gland, and the space where this gland is placed, a word is used for the retromandibular space between the mandibular ramus and the mastoid process. Here below, behind would be the mastoid process, and here it will be the our ramus of the mandible, and here this is the space where the parotid gland lies, retromandibular space. So I told you this is the parotid plexus of facial nerve lying within the gland. So this is the point. So the terminal branches, we know the 5 branches. I will tell you and discuss with you very soon. These are terminal branches. 5 terminal branches of facial nerve emerge from the gland at its anterior border. And of course, you know, if you recall my lecture on the facial muscles, the muscles of the facial expression, and they serve as a motor supply to the muscle of the motor nerve supply to the muscle of the facial expression. So it's a few words about the parotid sheath. This is already discussed with you in my lecture video on the fascia coli, which is the deep fascia of the neck. We discussed the fascia investing layer. The first layer was the investing layer of the deep fascia. So that was showing us a parotid sheath or the parotid capsule, right? And here we go with it, right? You see, this is a parotid sheath. You can see this here, right? And this is the parotid gland in here. And this is the parotid sheath. And here at the angle of the mandible and the mastoid process, the investing fascia splits and encloses this parotid gland by a superficial and a deep lamina and forms the capsule of the this parotid gland, also the parotid sheath, the other name for that, right? And the superficial part of the parotid sheath is very closely adherent to that, and the deep lamina is attached from very one important aspect is the deep lamina from this styloid process. This is the styloid process of the mandible, and from here it extended to the angle of the mandible. So already discussed in my lecture with the mandible. So that forms a stylomandibular ligament, which is pierced by this external carotid artery. And this stylomandibular ligament separates this parotid gland from this submandibular gland. It's the separation, right? So this is the point. And even here you can identify this parotid duct. It's very important. Parotid duct, the Stensen's duct, coming and emerging from the anterior part and going onwards. And I will describe you in detail very soon. You identify that. Here it goes here and it opens here. I'll tell you what it is. So then a word is used, parotid bed. It has an irregular shape. The parotid gland is shaped irregular. I told you it is pyramidal shaped because the area occupied by the gland, the parotid bed, is antero-inferior to the external acoustic meatus. So this is the point. And so let me show you. This is the layout of the, this, you see this dotted black line. Yes, here you could see this, right? And this is the layout of our this parotid gland with, you see, the structures below that. Like you could see here even, this is the posterior belly of digastric line below that, posterior belly of the digastric. And all these structures over here, and I will discuss what are the structures lying within the parotid gland arteries, veins, and nerves, and in a short while. So these are lying over here. The apex is related here with the posterior belly of the digastric, and a nerve which is the terminal branch of the facial nerve, the cervical branch of the facial nerve. This is emerged at this part, and these two veins, branches of this retromandibular vein. This is the retromandibular vein. You see, this is the retromandibular vein. It has an anterior and a posterior vein. This is the anterior vein, and this is the posterior vein of the retromandibular vein. And they also emerge at this apex of the parotid gland. So these are some important aspects of the apex, and this base lies here at close to this our zygomatic arch. That is the point. So this is the anterior aspect, and here this is the parotid duct emerging from its interior aspect, and this here it pierces the buccinator muscle. If you remember buccinator discussion in the muscles of the facial expression lecture, you recall and you see again, this is the parotid duct, the Stensen's duct, 5 centimeter long roundabout and thick walled, and here it goes, and this is pierces buccinator. So this is another point. So this is parotid bed I was talking about, And so a word about the parotid gland is that it is flexible because it contains fatty tissue present between the lobes of the gland. Why it is flexible? Because it has to adjust to the movements of the mandible. So this is, I told you, apex, base, and the lateral surface, which is lateral surface is subcutaneous and is almost flat. You could see again. This is I discussed with you the important points over here, which I wanted to discuss. So these are the various structures, and then this is a parotid duct. I told you already, and you could see after piercing the buccinator, it enters the oral cavity through a small orifice opposite the second maxillary molar teeth. I think we resort to this picture. You see this parotid duct. You focus on that. This is the parotid duct. Of course, this brings the product of the secretion of the parotid gland, which is the saliva, from here into the oral cavity, and this is the Stensen duct as well. This is 5 centimeter long and horizontal, and moving here it goes and here it turns medially, and here it opens into the oral vestibule, and opposite the second maxillary molar tooth, upper molar tooth, second upper molar tooth, opposite to that. So its opening contains a papilla, that is the parotid papilla, which is clinically important. So a few words of practical and academic importance. What are the structures inside the parotid gland? Somebody can ask you. I told you already with the picture that these are the structures lying inside the parotid gland, and parotid plexus, the facial nerve with its terminal 5 branches, retromandibular vein and its branches, external carotid artery and its branches, the parotid lymph nodes on the parotid capsules, and within the glands. So this is the point. Here you could see again, I told you already, these are the contents of the parotid gland. Here you could see retromandibular vein, external carotid artery, and this is the facial nerve. You could see various structures present over here in the this parotid gland. So this I told you already. Again, I'm telling you. So if you focus over here, please. And this is the external carotid artery going above. And here in the substance of the parotid gland, what is happening? It has one its branch is the maxillary artery. Here is the maxillary artery branch of the this external carotid artery, and then is the superficial transverse artery. Superficial transverse artery, and this transverse artery has a superficial temporal. Sorry, this is a This is a superficial temporal. This is superficial temporal artery, and this is the branch of the superficial temporal artery, which is a transverse facial artery. And here you could see this is the maxillary artery. This is another branch, right? So you identify this maxillary artery and this superficial temporal artery, and this is a branch which is our transverse facial artery coming from this superficial temporal artery. These are the arteries come at this anterior border of this parotid. These are the arteries related over here, and now focus on this retromandibular vein. Retromandibular vein. This is a retromandibular vein, and yes, here this is the retromandibular vein. I already shown you in the other picture. You can see here. This is the retromandibular vein. Over you could see, right? And here it divides into anterior and posterior veins, anterior vein and posterior vein. So this is some facts about that. And so how this is formed? Retromandibular vein. by this union of this these two veins. This over here these are shown, and you can see this is our this this what is this vein? Yes, you can see here. This is superficial temporal vein, and this is union with it is a transverse facial vein. Here it so this is forming the and this is the maxillary vein. These are the three veins over here, right? This is the maxillary vein. This is the transverse facial vein, and this is the superficial temporal vein. So how this retromandibular vein is formed? By this union of this our maxillary vein with that of the this vein, which is, you see, which vein? The superficial temporal vein. These two form the retromandibular vein. And this, at this point, I told you at about the apex divides into the external carotid artery. I resort to another picture which I showed you previously. So again into that, yes. So this was the retromandibular vein, and the main content of the our this concept. Yes, over here, so I told you. This is a very good picture. This, you see, this is the layout of the our parotid gland, and here at the apex, and this emerges. This is the anterior and posterior divisions of the retromandibular vein. These are the anterior and posterior divisions. This is the retromandibular vein. And here's how it is formed. I repeat, by the union. Retromandibular vein is formed by the union of this maxillary vein and this superficial temporal vein. Superficial temporal vein and maxillary vein unite to form the retromandibular vein, which divides into anterior and posterior divisions, which emerge close to this apex of the parotid gland. So again, and now they see this picture. This is the parotid plexus of facial nerve within the substance of the gland. You can see this is the facial nerve. Of course, facial nerve emerges from where? It emerges from this is the facial nerve emerging from the stylomastoid foramen. Stylomastoid foramen. Here it is. This is the facial nerve emerging from the stylomastoid foramen, and here it goes into the substance of the parotid gland and divides into branches. First of all, it divides into these two branches. This is the temporofacial division, and this is the cervicofacial division. And this temporofacial division divides into temporal branch and this zygomatic branch. And then the cervicofacial division divides it into buccal branches, the marginal mandibular branch, and cervical branch. So you see, these are the 5 branches. And I give you a mnemonic for remembering these 5 branches. The T for 10, and the 10 zebras bit my cat. 10 zebras bit my cat. 10 is the temporal branches, zebras are the zygomatic branches, bit the buccal branches, upper buccal and lower buccal, and the marginal mandibular, my, and C, the cat, the cervical branches. So this is the mnemonic, and this is the layout of this parotid gland with its facial nerve showing there, and this is the various branches and of the facial nerve. So you see, so first of all, we discuss the arteries in relation to the parotid gland, right? External carotid artery and its various branches, and the formation of the retromandibular vein, and then division into anterior posterior retromandibular branches. And thirdly, the facial nerve. This is the facial nerve plexus within it, forming these branches. This is even over here, temporal, zygomatic, buccal, and this is the marginal mandibular and cervical. This is the there. And the fifth thing is our this parotid lymph nodes. This is the parotid lymph nodes, which is present almost on the parotid sheath, on the layer of the, this is parotid sheath. This is the parotid sheath, and they are embedded over here, parotid lymph nodes. So the next slide, very, very important. So it's very important. If one will think, somebody asked you, I asked you, if the facial nerve spanning and going through and through this gland, look at that. So what it is, this is a substance giving these branches. Does it supply any of the nerve supply to the parotid, be it sensory, be it motor? For example, with the sensory, sympathetic or parasympathetic? Sensory, or like to the capsule or the skin over it, or the sympathetic, or the parasympathetic, secretomotor, or whatsoever? What would be the answer? Does it supply or no? No, it does not supply. The facial nerve does not provide any sort of innervation to the gland. So the sensory nerve supply comes via auriculotemporal nerve, which is a branch of the trigeminal nerve, which its third component, which is the mandibular nerve. It is closely related to the parotid gland and passes superior to it when the with the superficial temporal vessels, auriculotemporal nerve. You identify this. This is the auriculotemporal nerve, very important. And also this is a nerve which carries the secretomotor or the parasympathetic nerves to this gland. So this is a branch of the mandibular division of the trigeminal nerve. This is the mandibular, this is the auriculotemporal nerve. You could see this is the location of the auriculotemporal nerve. And it supplies sensory nerve supply to the parotid sheath and the skin over this parotid gland. Auriculotemporal nerve along with this great auricular nerve. This is a great auricular nerve. You can see this is the relation with the parotid gland. So two nerves, sensory nerves supply great auricular nerve and over this auriculotemporal nerve. And then is the parasympathetic nerve supply, very, very important, right? So this comes from the parasympathetic component of the ninth cranial nerve. So let's see what happens over here. You see this is the sensory ganglia of the our cranial nerve, ninth. You can see this is the our cranial nerve 9, glossopharyngeal nerve, and the ultimate point is the inferior salivatory nucleus, right? And you can see these are the presynaptic parasympathetic fibers, presynaptic, and from this inferior salivatory nucleus, these presynaptic parasympathetic fibers travel via tympanic nerve. This is the root, focus on that. Inferior salivatory nucleus, and this is the tympanic nerve. And as it moves on, here it forms a tympanic plexus in the tympanic cavity. And we have to trace this color, right? This is a sort of turquoise in this picture. And from here, you see this, it goes on over here. And here it's the lesser petrosal nerve, which this is all presynaptic parasympathetic fibers. These relays into the otic ganglion. Otic ganglion is one of the four parasympathetic ganglia in the head and neck. This is the otic ganglion, right? And from this, now of course, these fibers would be postsynaptic parasympathetic, right? And they travel via the auriculotemporal nerve, which is a branch of the our mandibular division of the trigeminal nerve, and this supplies to the parotid gland. This is the parasympathetic fibers, which when stimulated are secretomotor, and they increase the production of saliva. So this is the root. You see, this is the, you can told you again, inferior salivatory nucleus. There you see sensory ganglia of the cranial nerve 9, tympanic nerve, then the tympanic plexus in tympanic cavity, then the lesser petrosal nerve, then the otic ganglion relay the presynaptic fibers, and from this otic ganglion, the postsynaptic fibers go into this via this auriculotemporal nerve. This is the ultimate source. This is the supplying to the parotid gland. And then we get the sympathetic nerve supply. It comes from the cervical ganglia through the external carotid nerve plexus on the external carotid artery. I showed you that when the external carotid artery is present in the substance of this parotid gland, there is also present the cervical, there is also present the nerve plexus on it. Vasomotor activity of these fibers reduces secretion from the gland. Vasomotor activity of these fibers reduces secretion from the gland. So the sensory nerve supply I told you already, and you see this plexus, the nerve plexus of this. This is the external carotid artery, and here is shown the nerve plexus, the sympathetic nerve plexus around this external carotid artery. And few words about this lymphatic drainage of the gland. So this is the parotid nodes over here, right? You see this. These are the parotid group of lymph nodes, and they ultimately drain into the upper deep cervical lymph nodes. And if somebody asks you about the blood supply, of course, what should be the answer? Of course, the artery which is in the substance of it. Of course, this is the external carotid artery. So what is saliva? It's a clear, odorless, tasteless, viscid fluid secreted by the salivary glands and the mucous gland of the oral cavity. What's the function? It keeps the mucous membrane of the mouth moist. It lubricates food and helps facilitate chewing and the swallowing and mastication processes. It starts digestion of starches, and of course it contains enzymes, and it serves as an intrinsic mouthwash, right? And it helps prevent decay of the teeth, and very important for maintaining the oral hygiene naturally. So there are present accessory salivary glands quite often. These are present over the lips, cheeks, tonsils, palate, and tongue. So some clinical aspects, the clinical anatomy of the parotid gland. The tumors. So the salivary gland tumors mostly occur in the parotid gland. Whenever they are present, 80% of them are in the parotid gland. Very few times they are malignant. They are mostly benign, And when malignant, also this is specific mostly to the parotid gland. What is the treatment? Of course, this is surgical excision of the gland, which is called as parotidectomy. So important step is the identification, dissection, isolation, and preservation of the facial nerve. So because this is a point that the nerve fibers run horizontally through the gland, and the arteries are vertical. So as the nerve fibers run horizontally, what be the direction of the incision to preserve the fibers? Of course, it should not be a vertical. It will cut all the nerve fibers, branches, the 5 branches, and it should be also horizontal. So a superficial portion of the gland, often wrongly called as a lobe, is removed. So this is a complication of the this parotidectomy may occur, which is the Frey syndrome. Frey syndrome. What is that? If it is that after removal, what happens? I discuss over here. This is the parotidectomy. After that, there is the gustatory sweating. Gustatory sweating. When somebody eats a food, there is, instead of production of the saliva, occurs sweating and flushing. So few words about that. What is very important? Mumps. Everybody knows this is infection of the parotid gland, viral, quite common, spreads through blood, and it's the inflammation of this gland parotid is called as parotiditis. And so another word is used, sialadenitis. This is the acute sialadenitis. Sialadenitis, you can say, sialadenitis. This is also inflammation of the parotid gland. This sialadenitis is due to the parotid duct obstruction. And this is the parotiditis, inflammation of the parotid gland. And there the parotid gland swells. You know, whenever the parotid gland swells, there would be the very severe pain because the capsule or parotid sheath is unshielding in nature, very tightly adherent to the gland, does not allow expansion. So it's very severe pain when there is such infection. So this is a point, and the parotid duct can also be involved over here, which causes redness of the parotid papilla. So this is, I told you, and where the radiation of pain, the pain radiates when the parotid gland is involved. Of course, which are the nerves involved over here? Of course, this is the auriculotemporal nerve. You see this, and this even this great auricular nerve. So this is the auriculotemporal nerve. So the area involved would be, of course, around this temporal region and the auricle, this auricle and this temporal region. This is this area would be involved. This is the auriculotemporal nerve, also splice auricle and this temporal region. So the pain will radiate to the auricle, external acoustic meatus, temporomandibular joint, and temporal regions due to the involvement of the auriculotemporal and great auricular nerves, because they are responsible for the sensory nerves, the parotid sheath and the skin over it. So abscess in the parotid gland. Bacterial infection which is localized in parotid gland can produce abscess, which can be an outcome of very poor dental hygiene, and the infection could spread to the gland via the parotid ducts. Right? It could be if there is an infection in the poor due to the poor oral hygiene, in the parotid duct opening is there. That I told you, opposite the upper molar tooth, the parotid papilla, and from there the infection can go back into the parotid gland substance. So we have to determine if there is a problem of the parotid gland substance like this bumps. So that will involve the parotid duct, and the infection will involve the parotid duct swelling and pain. And if the dentist will tell whether the stem of the this abscess or parotid duct involvement over here is primarily from the cheek. So this is the point. From the mouth, where is the oral vestibule, where is the opening of the this parotid gland. So this is a very few words on that. Cyalography of parotid duct. Parotid duct cyalography. What is that? A radiopaque of fluid is injected into the duct system of the gland via a cannula inserted through the orifice of the parotid duct in the mucous membrane of the cheek. Then the radiography is done, which radiography is called as cyalography. So then parotid cyalograms are taken, so which show parotid duct system parts which may be displayed or dilated by disease. Blockage of the parotid, I already discussed with you. It can be due to a stone or calculus, and this calculus in the parotid duct is called as cyalolith. Yeah, I told you this is a Frey syndrome. With this, discussion of the parotid gland, parotid region is finished on my part, and I finish it, and hope so meet soon in the temporal region discussion, and stay in touch, stay tuned, and thank you for listening, and stay blessed, stay safe. This COVID-19 very dangerous. So wish you and best of luck to everybody. Stay safe, stay home. Best wishes, and everybody.